Welcome back to another panel of debate here in ehealthsummit.pt that you can follow this principal subject regarding technology and health. We will now speak of telehealth and how health is closer to citizens and the challenges that the pandemic brought in the area of health. In this debate panel, we have Duarte, Director of the National Center for Telehealth, Delfim Rodrigues, Hospital Administrators, Micaela Monteiro, Medical Director for Digital Transformation, and Válter Fonseca for the DGS. Duarte, I will start with you. We speak a lot about the impact of the pandemic in all the society, but especially in the health area. In the case of telehealth, it was one of the solutions found to respond to the pandemic. Yes, it was obviously the solution, the most sought one in the beginning of the pandemic by all the professionals of health, and the citizens also understood that this was the possible solution to approach and maintain the contact to ensure the care that people needed, but to give answer to this need of searching information that COVID-19 brought. A lot of uncertainty, a lot of fear was brought, and SNS 24 had a great role in the triage and then the follow-up of the patients and the context the COVID-19 patients had at a distance, and this was the answer. Delfim Rodrigues, we were surprised in the last year by a pandemic that nobody expected. Was it needed answers, immediate answers? Did health have to react? Was telehealth the solution that, in your opinion, it is important to stay? Good afternoon. Undoubtedly, yes, without any doubt. The key issue is information and how we deal with the information, how we treat it, how we communicate it, and how we make it reach our patients. This information is a different resource from others. Any material resource, more and more we dilapidate it, starting by our money. But information, the more we use it, the more people are informed, they were wiser, and this power that information has then dealt with the different levels, that the health departments had an excellent part in this period. But allow me, when we speak of telehealth, telecare, I remember always a famous interview in '79 from Bill Gates and Steve Jobs when they're still youngster working in a garage. And Bill Gates was saying to Steve Jobs, this will start to be interesting the day we were able to integrate A1, voice, image, and data. This is our challenge. And in particular, to finish, to tell you that the telecare at the home, that is great success in the national system care, was the only line of offer internment of patients and home that grew within the pandemic. In the first 6 months, it grew 800%. If we compare it to year after year, it had a growth of 400%, and this was possible not just by the training of teams, medical professionals, pharmaceuticals, nurses, nutritionists, psychologists, psychotherapists, etc. I can't remember all of them, but physiotherapists as well. They go to the patient's house, and they grew, and as our colleague Duarte mentioned, they added quality, and we need to, Válter knows this better than no one, we also have to increase here, to add here, the variable security. Since they are telemonitored at home, the vital signs, basic ones, the patient and its family gain security, gain trust, And those data, they're transmitted online through the several technological solutions to the professionals. It gave trust, added trust to the professionals and the system itself. So there are solutions that are here to stay. Yes, I'm not going to reproduce the announcement of the 60s, but surely in the 21st century, and in particular, in the second decade of the 21st century, not just to stay, but to develop and to expand itself. Thank you. Micaela Monteiro, can we say that the pandemic accelerates the transformation digitally in all areas, but specifically in health area, and telehealth is an example? Yes, we can. We can say that it came mainly to accelerate the awareness of the population, of society, and also the organizations, of course. And when in terms of telehealth, telecare, and digital health. And nevertheless, we face the risk that after one of the great motivations, and this was spoken earlier, for the people to adhere to teleappointments, it was clearly the fear they had of COVID. On the patient level, the citizens level, but also the professionals. This was one of the great drivers for adhering to the teleappointments. And we hope that in a few months' time, the situation of the pandemic will start to go down significantly, and we will start slowly to go back to our normal day-to-day lives, and this driver will not exist anymore. And in that aspect, it's very important to understand that telehealth, it's not just teleappointments, and Dr. Delfim spoken earlier about it. It has more to give than just being a proxy of what we cannot access to, because at that point we have a threat, a transitional threat, that it was this disease that conditioned our lives. So it cannot be seen just as an alternative, but as a solution. It should not be abandoned. Válter Fonseca. Good afternoon. I would only go back a little bit and say that one of the great successes of the telehealth area responding to the pandemic was to be a concrete answer to a need. Many times we try to implement projects, they are apart from the concrete needs. Here we had a need. It was very concrete to give answer to a situation that was new with great uncertainty, and telehealth was the best solution. And then it was proven that to ensure not just the quality and security of care remotely without people coming to the health centers or hospital, and also fomenting trust of people, professionals, and society in general that maintain themselves protected. Regarding the issue you placed, alternative or solution, I believe that is a solution and a complement. What were the needs of the pandemic? Naturally, they accelerated, as we've seen before, the use of telehealth and the surrounding areas. It started as a solution, but it will be in the future, I think, a complement to the clinical activity. I don't think we will go back to what we had before the pandemic. We maybe won't use so much telehealth, but we will have digital innovation and usage as a complement for the future. Duarte, we spoke of an issue of trust, the trust that the patients need to have, and the relationship so important in medicine, the relationship between doctor-patient, humanizing health that we spoke so much, and the work done here in Portugal and abroad. The technology here, we wanted to be an ally. Is this a great challenge for people to understand that health will continue, the professionals will continue close to them, yes, it's a challenge, but I like to look at this as a nexus with three parts. Technology, already spoken, people, and I am speaking of health professionals and patients, and the process. I believe, above all, the patient has a lot of sensitivity, and the citizen in general has sensibility when they're looking for health care, and they want a result. They look for a result, and that generates a trust in what they do. And it goes both ways, for the health professionals and for the patient. Many times we think all these problems derive from lack of technology or not so mature, or people not knowing about the technology or not being able to use it. But sometimes I think it has to do with the process. The procedure is more important than everything else to us that are on the side of the citizen, to have an experience, even if different, with different means, to be equal or better than the one we would have in a classical way, a traditional way. So gaining that trust is very important. And then to think that many of this usage of digital means can be with health professionals that we already know, our family doctor, our specialists, that we already know, that we have already been seeing before we used masks, before that we could see the smiles on people's faces. So the process is what generates trust. If the people know that they're not lost in the system, they don't know exactly where they are, and the doctors as well. So Delfim, Rodrigues, what Duarte has mentioned leads us to another point, giving capacity to the health professional. As Hospital Administrator Association, do you think this is crucial? Yes. Picking up the question Duarte was saying, if we look around us today, the organization of success organization, whether they're private, public, whatever, they have two components that are fundamental, based on people, but they are high-tech and I touch, a great touch of human touch, a great sense. And indeed, this is what is happening. We think sometimes when we study medicine, we start with great robotic solutions, with equipment that today we don't know about. Surely, yes. But the future of medicine is not that one. It's a proximity medicine. It's closer and closer to the patient, its family, and the patient before he becomes sick, when he's a healthy person. And our mission is naturally to promote health and protect him from disease. This is a central issue. I think the health professionals, whether they're doctors, nurses, you know that we have 100-ish profession. Just diagnosing technician, we have 53 professionals. You do not find any company in the world where we have 100-ish professions in the same institution. And this happens in hospitals today. So the policies of enabling of professionals, they need to, first of all, start from the patient to the professionals without losing focus in the patient. And it cannot be done, sometimes we see this, in a corporate way and professional group to professional group. The enabling teams needs to be done. Today, we don't have what we saw in the 50s and the 60s of last century, when we went to London and we saw one-man band, a gentleman in Oxford Street playing whatever, several instruments, like Bob Dylan. Today we don't have that. We want an orchestra and with synchronized movements. And the more synchronized our teams, the more motivation, more enthusiasm they have. And focusing always on the patient. We're not enabling ourselves to be enabled. No. Translated in Portugal, to give power, empower the patient. I don't like that term in Portuguese, but Micaela Monteiro, we're picking up this metaphor that in this orchestra that sometimes we need to tune. How this technology will enable us to tune this orchestra that is health. I think technology, and Duarte already spoke about it, is what we do with it. It's not technology that's going to tune us. We will have to tune it. It's just a tool, yes. And we need to know very well what to do with it. Because in itself, it's nothing. It's what it is. It can be used for good or bad, or can be neutral. So I believe that this is very important. And we need to design workshops, clinical workshops for the patient. They start in preventing the disease, yes. The most correct term should be citizens' health workshop, and those workshops in the future will be hybrid. What does that mean? We will have the so-called Woodstock touch points, human touch points, as we know them, the traditional ones that are the basis for healthcare, but also we will have touch points, digital ones, of remote interaction, and we need to understand what is best at each point for what we want and what we will want, or improve results in health to make them better, or we will be wanting to be better, more efficient, using less resources, or we will want to improve the experience or the experience of the citizen in their workshop in health, or the experience of the professionals. And we will need to select which tools to reach those objectives, those goals. So we will have to tune it, the processes, the workshops, hybrid workshop, and technology, as long as it evolves and brings more opportunities. I'm speaking about data. Dr. Delfim has spoken about data as well, and use this data and that knowledge in order to be more and more together, added value. And we will have to adapt these workshops. It will be a constant adaptation of this hybrid workshop that I spoke earlier. Válter, Fonseca, in which point, what type of technology do the health professional have to contact the patients at this point when we speak about telehealth, telecare? Well, they have several mechanisms, from the more formal to the informal ones. Undoubtedly, today we have something very powerful in our pocket, our smartphone. It is a very powerful tool and has been used informally by the healthcare professionals to contact their patients, the people. On the other hand, we have progressive installment of technological means in SNS, in our health system, that allow through systems, calls, phone calls, telehealth by video, or other mechanisms, remote mechanisms of telemonitoring that are now starting. They are more and more available. And this is naturally in a perspective of primary care and hospital care. We can see the technology in another perspective in the topic of data that were mentioned earlier, because technology does not come only to change our experience in health, terms, in the individual contact between the person with the health team, but also has a great potential of changing our experience as a collective. Why? Because we will have the possibility that we never had it before to continue and analyze a series of data that is brutal and will certainly educate us and make us take decision futurely based on more concrete data, but data of our reality, data of our Portuguese patients, of our diseases, of our people. And this is a collective perspective of what technology, digital transformation can bring to health. Duarte Sequeira.
What balance can we take? What stock can we take of what Portugal has done compared to other countries? Portugal is fortunate that it has a solid digital basis and is a benchmark in Europe. There aren't many countries that can boast having, for example, software for medical prescriptions. So we have prescriptions online, we have tests online, we have electronic register, which allows doctors to be in a healthcare unit and having access to the patient's information no matter where he is. And that is important for us to dream and build upon this. If I had to characterize the way this is being acted out, there's been a lot of collaboration. People came together, institutions came together. They had to, whether they wanted to or not. They all had to sit around a table to solve concrete issues. And this is something that doesn't always happen, unfortunately. This is something we need to congratulate. We worked side by side, COVID-19, SNS 24, NHS 24, and other aspects that were developed this year. We did things in record time. They wouldn't have happened were it not for this. So this model has proven that it adds value. So what do we want to do next? On the one hand, we need to understand the difference between an online consultation and a normal consultation. Isn't that the patient is at home and the doctor is in front of a computer? No, it is to understand that we can reach more people, people that perhaps wouldn't have access to that care were it not for this system. Or someone who has a more complex disease and needs ultra-specialist care and is perhaps the other side of the country or in another country. In May, we did a proof of concept at the European Union on this, and we also need to think about other aspects. Like rehabilitation, which was very dependent on the number of people we have on the ground versus the number of people that can be in a session at the same time. And we need to understand more and more that patients and us are increasingly prepared to be autonomous. And the idea of the paternal healthcare, paternal style healthcare has gone. People have become attentive of their symptoms. They were attentive what happened. They are increasingly conscious and ready to collaborate in their health process. And that shifts the equation. It makes the patient a user and a partner, and that makes a difference. I'd say that what lies ahead of us is to consolidate this, to grow, and see how we can reach more people. And in all the stages of the process, as Delfim said, in terms of prevention, telescreening, and other areas that weren't as covered now, and which can now be in a different way. Delfim Rodrigues, we will talk about the important aspect of never forgetting that we are working and creating for the citizen, the person who needs healthcare. Should we look at non-COVID patients in a different way? Should we look at the patients who need it and will continue to need healthcare, not necessarily because of the pandemic? For these patients, should we speak to them in a different way in terms of healthcare as an integrated offer, including these remote medicine systems? Absolutely. Our association, the Portuguese Association for for hospitals has been flagging this situation together with other entities, some more institutional, others less institutional. It is what we call the dual system. It's like in our life and political expressions in society. We cannot leave citizens behind because of others that merit more consent. That is why developed societies, and when they are touched by crises, I'm not just talking about pandemics, I'm talking about financial crises as well. And as we all know, the more developed societies, the ones that are more focused on people, that high touch that I spoke about, they have dual systems to manage the various social layers, even gender issues, ethnicity. All of these issues need to be addressed because we are not all the same. In fact, the Constitution doesn't enshrine equality for the Portuguese people. What it says is that it is unfair to treat equal situations unequally. So even in the Constitution, we should be aware and attentive of our grammar, our narrative. I don't know who invented this term, but fine. Narrative turned up, didn't it? So hospitals are already endeavoring and working towards recovering waiting lists, tests. There's no point in citing numbers here. We all know them. Because we know that postponing any type of treatment that a patient needs, we can say it's not urgent. I can say so. I'm not a doctor, so I can say a few things that perhaps other people couldn't. But what remains to be shown is that issue. Oh, when we say, oh, but the patient isn't urgent, we still need to prove whether if I postpone that patient's treatment, won't that have an impact on his or her health status? Oh, it's not urgent. He or she can be operated in 3 months' time. There is no scientific evidence to prove this. If he or she needs surgery when they have the condition for it, and to have these conditions are decided by doctors, not just surgeons, also specialists, depending on the type of surgery. So to sum up, the country needs to make a huge effort to recover those who were left behind, who didn't suffer from the pandemic, but on the other hand, some died in their waiting list, we know, and others are still waiting, worsening their health status, in this case, their disease. Very well. For that, our association is adamant in this. We are all adamant with regard to something here, but we are an association that doesn't advocate professional interests. We do also, but in the NHS, we are patients' advocates. That is our mission. Thank you very much, Delfim, Rodrigues, Micaela, Monteiro. We will now go back to the issue of telehealthcare, telemedicine, to figure out how the strategic telehealth plan is going out and how you view the future. I think you have a presentation to share with us. You were saying how it will be in a few months' time when we hope the pandemic resumes. People will calms down. Will people go back to their in-person consultations, or will we show them there's an online tool? Well, with regard to the first part of the question, how we are in terms of operationalizing telehealthcare. We will, although I was engaged in its drafting, at this moment I'm not involved in drafting we'll let Duarte speak about it. But I know that it is moving forward, and Duarte can perhaps offer you examples later on. Well, regarding your second question, if after the pandemic we will be redesigning this health travel, this health, the way the health system is going, well, it depends. As Duarte said, we have a lot of conditions that are met for us to be able to do so. Namely what Duarte said. And Dr. Delfim has also drawn attention to it. It has to do with information management in an electronic file, electronic prescriptions. We have been growing in terms of the technological infrastructures in the healthcare units that withhold telehealth. We are building capacities and empowering professionals, but there needs to be a willingness to have this digital transition in healthcare. I've already said we had a strong driver, fear, the fear of COVID, but not just fear. I would say the ethical imperative of giving healthcare to everyone, and telehealth was the solution found for this. But for telehealth to work in the future, it is important for there to be a change in the processes that Duarte spoke about. We need to start doing things differently. Remote monitoring is one of the examples. Chronic disease. Which will be the group of patients. At the moment, we're very much focused on an infectious disease, but it's chronic disease that will restrain the future of healthcare and that will use up a lot of its resources. And chronic disease can be prevented, can be delayed. And when they do happen, they need to be handled in a proactive, a preventive, and continued way. And remote monitoring is a way of doing it, of constantly monitoring the patient in his or her usual environment, his or her home, with his or her family. But to do so, we need to change the current procedures, because for chronic disease at the moment are managed on a case-by-case basis, and you have routine appointments, but people can have incidents in between the appointments, and remote monitoring is a way of detecting this early on and having the possibility to intervene. But those are the procedures that we need to change. The organization of the way in which we work, but also incentives, financial incentives, so that a care that is focused on results rather than medical procedures is feasible for the organizations. And Dr. Delfim will speak much better than me about this subject.
Válter, Fonseca, what can we expect of the future and what lessons learned from this pandemic? Well, I think that we had ideas and concepts already here, but I will focus too. All of us, in a different way, we spoke of processes, workshops, navigation, flows of people, because the system of health is a set of people that navigate from one place to the other, hoping that the person that has a symptom, a concern, needs a care, to find the right team to deal with it, to treat him, to take care of him. The second aspect are complementary actions and hybrid models. I think the digital transformation that was accelerated with the pandemic COVID-19, and Duarte has spoken about it, he represented as well a moment of added value by the historical union and the partnership work in the several health institutions, but now it was accelerated, and in the future, it will translate in two things. On one side, the digital transformation will allow us to navigate better the health system. The process will be more agile and for people not to get lost. One of the great challenges throughout time, in terms of quality and health, difficult to implement, is for the person to be the same in each level of care, because the process is lost, because we don't know if they did this exam or that one. And with the digital transformation, we will probably have no one getting lost in the system, because the person is the same person anywhere she goes. And it will be accompanied, followed by a system that knows exactly where they are. And it's the same person, inside and outside our borders. The second aspect is the hybrid model. This model that preserves the humanity of the clinical action, preserves the human contact without which we cannot give care, and can escape the potential giving the administrative process and bureaucratic process can be replaced by digital tools. So this hybrid model will be the future. This is our hope. It implies a change in the culture, in the quality, but better navigation, hybrid models, and better quality with the digital translation. Duarte, there's another issue to answer. In each point is the strategic operationality of the health plan. The strategic plan was designed in 2019, and with the pandemic, we thought that we needed to create an operational plan for these 2 years, because the other was visionary, but it was not visionary for a pandemic and everything that changed within the pandemic and accelerated. So an operational plan was created, very concrete, with several entities, the professional associations and other actors in the health system, with concrete measures, practical ones, with a temporal horizon well-defined, and it manages all this spoken earlier. An effort to adopt these types of practice, not as a complement, but as a creation of a digital service, because that tele is there as a prefix, and then it will end. No, maybe in the future we'll only have health, but it will be a health taken care by a digital mean. So creating these digital services to aid, to increase certain follow-up, certain diseases, because we understand that certain institutions, hospitals have a few insecurities, and since security is a very important aspect of the clinical practice, so it needs to be dealt with. And then the issue of data, using data and as the goal to bring better health, and not just to make good papers. Bearing in mind the risks, exclusion risk segments, and creating the SNS 24 branches, in the localities to allow people without computer to have a telehealth appointment. In security, we have more than 50 branches opened up in the first half of this year. And I finish with this provocation. I will add just one thing to say that the Plan of Recovery and Resilience has a very key role here. A lot of initiatives are enrolled, acquiring equipment, telemonitorization for the institutions, and creation of better integration of the system as a whole. So now we have hospitals that work many times alone, and now they can group themselves in as a region and have a doorway to aid them, that is SNS 24. Having a call from SNS 24, a patient that is being monitored, to be able to make a call and have a triage well done. So going back to the provocation is a book that changes the idea that when we are waiting for an appointment, doctor's appointment, we wait several months, we are anxious, then we wait 30 minutes in a waiting room, and somebody comes and says to the patient, the doctor will see you now. And the book changes this on us, changes this and says, the patient is now ready to see you, doctor. So it's the other way around. And this is something that makes sense. It's this moment precisely to have eye-touch moments, humanity. We have the patient in front of us. We are talking to him, and then we replace, as Válter says, the administrative tasks, bureaucratical tasks. Make no sense because they occupy too much time of a doctor's, nurses, and then have this moment where he's not in front of a professional, but he is contributing through the queries he answers, through the data he gives, and whatever. And so create this idea that the patient is there and that will change, and we cannot have a paternalistic idea that the patient always needs us to take care of him. No, we have physical moments and remote moments. Thank you. This is how we end this conclusion from Duarte Sequeira. Thank you for the four of you for helping us to think in the present what is the future of technology in Portugal. Thank you for being agents of change, and I'll see you soon. Thank you so much.